Good evening and welcome to Advances and Innovation in Musculoskeletal Health series, Technology at HSS. We're pleased to have you join us for the last webinar of this series tonight. While previously we discussed the lower extremity and spine specifically in the past webinars, tonight we're really going to zoom out a bit and talk about some specific technology across all orthopedics and ways that innovation and tech are advancing orthopedic care at HSS and how we're working to improve the health of all of our patients. So I'm pleased to introduce our guests this evening. First, Dr. Eytan Debbi is a hip and knee replacement surgeon at HSS and one of the handful of orthopedic surgeons with a doctorate in biorobotics, biomechanics, and mechanical engineering. He is an expert in minimally invasive hip and knee replacement surgery, including anterior hip replacement, total knee replacement, hip resurfacing, and partial knee replacement. And next, who is returning as a part of this series, I'm so pleased to introduce Sandra Bossi, who is the Director of Care Delivery at the HSS Innovation Institute. In this role, she is responsible for supporting HSS efforts to improve healthcare access and delivery through various projects involving artificial intelligence, technology, data analytics, and digital healthcare. So I could not think of two better speakers to join us this evening, and I'm so excited to learn with you and with our audience tonight. So to get started, Dr. Debbi, if you don't mind kicking us off, overall, really, how does technology advance surgery and patient care, and how does innovation impact our health outcomes in patients, in your patients specifically, and in all orthopedic patients?
Sure, of course. Well, first of all, thank you for having me. It's really an honor to be part of the series. I'm also excited to be kind of standing side by side here with Sandra online tonight, and good evening to everyone in the audience out there. To me, as both the orthopedic surgeon and a joint replacement surgeon, but also someone who has a lot of research experience and a doctorate in engineering and biorobotics and mechanical engineering, to me, I'm very excited to see kind of how technology can be applied to patient care. And it's basically kind of the cornerstone of how I approach patient care. To me, technology allows a very individualized approach to patient care, whether it be non-operative or operative treatment. And from an operative treatment standpoint, a lot of preoperative planning is based on technological innovations that we have. And ones that we have that are cutting edge here at HSS, and as well as intraoperative execution. So basically our ability to do what needs to be done in surgery more precisely and more accurately for each patient. In the past, a lot of our surgical procedures were more generalized, and now me and my other colleagues who use the technology that's available to us are able to really individualize our surgical treatments for each patient specifically. Post-operatively, this process continues. I mean, now we're having more and more technology that allows us to monitor our patients very carefully after surgery, not only for things that can potentially go wrong, but more importantly, kind of watch their progress, see how they're doing, and able to kind of help them along for whatever their recovery may be. And that's how I see kind of technology in healthcare.
Great. And so we're going to discuss all aspects of the trajectory that you just mentioned. So really looking forward to diving into it. And before we do, though, Sandra, if you don't mind, could you describe the process of innovating tech at HSS? Who are the key partners, and how do these partners play a role in innovation?
Of course. I can speak how at the HSS Innovation Institute, we develop those technologies that help us innovate and support the innovation culture at HSS. So we have three verticals: medical devices, life sciences, and care delivery, the vertical that I lead. And as you mentioned, all these technologies, digital, various applications of AI and machine learning, data analytics, and motion capture technologies go under that umbrella. So how do we do that? We review about over 100 opportunities annually. So a lot of projects come our way, and they can be both from internal inventors, from very creative HSS community, HSS surgeons, researchers, scientists, biomechanical engineers, rehab experts who come with novel ideas to us. And we help them evaluate them, and we help them, if we decide to move forward, we have an infrastructure put in place to help them develop those ideas, protect them, test them through various prototypes or validation studies, in order to bring them to become real products and commercialize them. So that is our inside out process. And HSS, being a 160 years old institution, solely focused on orthopedic, has accumulated a lot of knowledge and unique expertise that really allows us, it's a privilege to work for Innovation Institute and to support that culture of innovation. The other model, outside in, is particularly relevant when we talk about the technologies that are being developed. And we want to take advantage of all the technological advancements that are out there in robotics, in AI, in machine learning, in computer vision technologies, and partner with the companies who have those expertise in AI modeling, in developing robotics, and infuse them with our own clinical expertise. And that's where we can truly innovate and bring very innovative solutions. And I was really impressed to hear Dr. Debbie's background. He seems like a person who captures all those competencies that we are often looking on the projects where it's really interesting to have teams from clinical background, biomechanical background, computer vision, or any other work together. So that is our outside in process. And we really we are very, our diligence process is very rigorous, but what we are looking for the companies and partners that align their values with ours. I want to mention there are lots of technologies out there, but we are really looking for the ones that are trying to, in an impactful way, influence healthcare and really solve solutions that need to be solved. So we have that priority to really remain focused on solving important orthopedic problems using those novel technologies.
Yeah, that's so great to have a better understanding of where these ideas are coming from. And you mentioned solving problems. And so that's what we're going to start to talk about, is solving the problem before surgery. How do we ensure that a patient is receiving the most personalized, the most individualized care? And Dr. Debbie, I know this is something that you're working on. So before surgery, what happens with gait analysis? Can you describe what it is and how it's improving outcomes for our patients?
Of course. First, Sandra, you're too kind. I appreciate it. And, it's always a partnership. We couldn't do anything without you guys allowing us to kind of figure this out and bring this technology really to the bedside. And I think if we're talking about technology, at least before surgery, gait analysis is just one aspect of technology that we have available to us at HSS in terms of preoperative planning. And gait analysis is basically a way of us being able to understand how a patient moves. And it's one aspect. And I've done a lot of research and development in gait analysis. And my specific expertise is in knee and hip replacement, but it really applies to the whole musculoskeletal body. Each person has a unique way of walking. And when things go wrong with maybe their hip or their knee or their spine or their ankle, they oftentimes walk abnormally. And we're able to capture these things with gait analysis. And we also have other tools, other mobile wearable technologies that are coming out that are able to also capture these in different ways. We're able to capture patients' motion, how they walk. Are they walking slow? Are they walking fast? How many steps are they taking? And then beyond that, we're eventually also able to see their general activity level. And this is able to, one, maybe indicate patients for surgery, but also determine kind of what their function is, what their potential recovery could be like after surgery, what patients can expect. And that's all very helpful for us.
That's great. And are these wearable technology like a Fitbit or an Apple Watch that you can take home, or is this something that you need to go to a healthcare institution to access?
It's a great question. I think really, on the ground, things are changing really on a daily basis. I mean, wearable technologies such as Apple Watch or Fitbit were considered, some unique devices many years ago. Suddenly now many patients have these devices, and some of them don't have to be expensive. They can be low-cost devices that can give us great ability to monitor patients' activity levels. In some institutions, it's part of the care. In some institutions, patients use their devices, but oftentimes just your cell phone is now monitoring your activity to such a level that we're able to maybe capture this. This is still stuff we're still looking at and trying to figure out how we can use this to provide patients appropriate care. And that goes for both before and after surgery.
Great. And one of the other preoperative planning measures that I know you're working on is EOS imaging. Can you talk a little bit about that?
Of course, yeah. So something called EOS imaging allows us to get low dose radiation X-rays of patients before surgery. We get them after surgery as well in many cases, but before surgery, they really allow us to accurately and precisely plan our surgical technique and provide an individualized treatment protocol for each patient. And for example, in knee replacement, it allows me to plan exactly how to align a patient's knee replacement. In hip replacement, it allows me to know their exact limb length and plan the exact implants that patients may need. Some patients, for example, may be at just a high risk for a hip dislocation after surgery. With something like an EOS film, I'm able to accurately and precisely plan their surgical intervention for hip replacement with the components positioned as best as possible to prevent something like a hip dislocation. But we're a high-level institution, so I can have patients who have had a hip replacement elsewhere that are having issues with stability of the hip. And this is I see this, quite often, where now I can get an EOS film and right now able to decide exactly how to maybe change or revise their implants to prevent the issue. And this is some of the research work I'm also doing actively as well.
So you're researching in both gait analysis and EOS, and I'm sure many other things. And are these becoming the standard of care? Are they currently the standard of care? What can patients expect even outside of HSS when they're going for an orthopedic consult or surgery?
It's a great question. I hope they do become one day standard of care. I think right now, we don't have this technology across the country, let alone across the world. I think with time, it will spread and more institutions will have this kind of technology. Right now, in my practice, EOS films are my standard of practice, and in the standard of practice of most of the at least hip and knee replacement surgeons that I know here, because it really does help us plan our surgery appropriately here at HSS.
Great, thank you so much. And on the other side, or not necessarily the other side, but Sandra, thinking about the projects that you're working on in preoperative planning, can you talk a little bit about MyMobility and the MyHSS Care Guide and how this might impact the pre-surgical experience for patients?
Mm-hmm. Right. So MyMobility is a patient management digital platform that allows for better communication between clinicians and patients. And it was developed by Zimmer Biomet, and they have partnered with Apple to allow for patients who are enrolled in MyMobility also to use Apple Watch and collect additional data. We have a partnership with Zimmer to really raise those standards of care by integrating HSS surgical episodes, surgical care pathways into the MyMobility, and allowing patients to have that more connected and more personalized approach to care throughout their surgical journey. And if you want, we can pull out the slides that I have prepared. So that's the first of its kind. When Dr. Debbie talked about, is this a standard of care? It is not yet a standard of care, but we do hope that one day we leverage the capabilities that technologies have in allowing us to connect better with the patients and to monitor them better throughout their surgical journey. So this is how that app looks from the clinician's perspective. This is the screen that patient can see to monitor their patients, and patients are using their iPhone, or it could be an Android phone that connects, and that it's an app that's being downloaded to to their phones. They can also use it in conjunction with Apple Watch to collect additional data. And if you move to the additional slide, you will see what that means for a patient going through that peri-surgical journey. So the app starts, that journey and the content that's being delivered to the patient starts 45 days prior to surgery. And the patients are provided regular daily timely reminders. Also they are being advised through their surgical journey on the things they need to do and accomplish, that educational modules that are being given to them. They also need to complete some surveys, which provides additional information to the clinicians to follow them. And at the same time, if they're using an Apple Watch, additional data is being collected, and the data is also being reported if they decide to share with their clinicians, also on the clinician dashboard. So the question is, like, why is that important? Why are we doing that? Well, today we know that a lot of our patients are the users of such technologies. We know that they like reading things digitally. We know that that information can be presented in a more meaningful way, and that's more memorable, that stays with them. And at the same time, they can track their adherence to the completion of those tasks that they need to do. And at the same time, the data around their step, around their gait is being collected to understand how well to guide them to become better prepared for the surgery, with the hope to have a better surgical outcome. So this is one project, My Mobility, that we have done. It's in partnership with Apple. It could be another, it could be another wearables that other institutions are using. But we have done pilots at HSS and received a really extraordinary feedback, positive feedback from both clinicians and patients. We had the patient who had a surgery at HSS, and then 3 years later with My Mobility, and reported that his recovery was much faster. I was very grateful that he was part of that program. So definitely things that we as healthcare institutions need to be more involved. That's part of that innovation that we are spearheading at Innovation Institute. And it will be exciting to see how those technologies will be continue to be implemented and used in the future to better guide patients through their treatments, recovery programs, and also the preparation to a certain surgical procedure.
That's
So great to see that,
Yeah.
really, I would say as a patient, it's something we don't think about, to be able to kind of see your recovery live. Even as a surgeon, kind of seeing that, being able to offer that to patients is really incredible. And I really think having that instant feedback, I think, we will hopefully see improved recovery, like you said, Sam.
Absolutely. And yet another example of how we all need to collaborate to ensure that our patients are having the best experience. Because without the education piece, without the, physical therapy or rehab piece, post-op piece, that's fantastic. And you mentioned, Sandra, that it was in pilot. Is it still in pilot, or is this available to all patients?
It was a pilot. It's not available to all patients, but we are also developing our own MyCare guide, which provides that digital content to the patients and engages them more through their surgical process. So that's part of our MyHSS app that patients can use and download, and that's being also developed. The advantage of using wearables technologies in conjunction with a digital app that you download on your phone is that all these biometric data that's being collected, that is not as of now being used in clinical decision making, and Dr. Debbie Codd probably could say more about it and explain, but this for the first time, we are able to collect that data. And so we will need some longitudinal data to collect to understand what are the correlations between their patients' reported pain levels and their activity and the number of steps they do and how that impacts pre and post surgically. So there's a lot of insights that potentially could be gained, and that's the value of doing it, even though right now the clinical decisions are not based upon that data.
It's exactly like what you said. I mean, I do a lot of research, a lot of clinical projects, and at the end of the day, when we want to say something, improve something, we have to show it, we have to prove it. And having this technology, these wearable technologies, we're going to start getting this data, and it's tremendous amounts of data. And we can actually start doing these studies now that we're collecting it. That's why these pilot studies are so important, to eventually be able to show that it works and then actually be able to implement it on a larger scale.
Do you anticipate that the data will also change possibly the course of treatment for certain patients based on what you find?
Actually, it's hard to know right now.
What I could say is, like, by looking at the responses and the things that we have learned through those pilots, it definitely allows us, when I mentioned that more connectivity and better connection, usually like post-surgical patients, they would come for a visit, but we don't know on a daily basis what their activity levels are. Those are not being tracked or monitored. And by doing that, the clinical teams can have a much better insight on how patient is doing. Are they moving enough or are they not moving enough? I have one anecdote that as we were doing those pilots, we had a patient who was abnormally active, more active than he was supposed to be post-surgery. So our rehab teams called the patients and realized that patient's spouse was using the phone. So
running marathons after their knee replacement, yeah.
So it's also important when we use and rely on those technologies for clinical decision making. One, what we didn't mention is that they are validated for accuracy and repeatability, which we often do when we partner with the companies, and we have those capabilities in our labs to validate the technologies. They can be used in a clinical setting. But the other thing is also to ensure that it's the right user, that they are correctly being used, correctly placed to collect the accurate data.
Great. And I think that really leads us nicely then into how we're preparing patients and how patients are preparing themselves for surgery, but then also what is happening during surgery. So I know one of the hot topics is robotic assisted surgery. And I'd like to start with that just to kind of clear the air and demystify what exactly robotic assisted surgery is. Because I know that sometimes there might be a misconception that there's some sort of robot doing your surgery, but Dr. Debbie, please enlighten us.
Sure, I could talk about this for a long time, but it is very exciting. The technology is exciting. At the end of the day, we hear about robots. We hear about robots in surgery. A lot of patients come in asking, well, I've heard about this. I'm interested in this. What is it? How does it work? I think that, there may be this misconception out there that somehow, the surgeon just kind of steps away, goes and grabs a cup of coffee while, some robot walks in and does the whole surgery. It's nowhere near anything like that. And at the end of the day, the term robot really just means that, we have a tool in the operating room that allows us to more accurately and precisely do the surgery. I kind of presented it to patients like this. I think it's like parallel parking a car. We can parallel park the car. I'm trained to parallel park the car, but having the camera and the sensors is helpful. And I think that in surgery, having them is even more important. Different robots, they come in all shapes and sizes. Some of them have robotic arms, some of them have certain cameras, but the bottom line is that it allows us to execute the surgical plan more precisely and accurately. And many of the systems also allow us to do more accurate preoperative planning as well. And that's kind of where the technology is now. And there's all sorts of different robots out there. It's really a privilege to be able to work at HSS, where we have a large majority of these robots and are able to apply them here in the operating room. And that's very exciting.
And is this something that where we have people from joining us from all over? So again, is this something that we see in commonplace in operating rooms, or it's really specific to, the New York City area or HSS specifically?
So it's a great question. So robots are becoming widely popular across the globe, a lot in the United States as well. So it's not something that's just in New York. You can find it in many major cities in the United States. And it's not, but it's still not becoming that commonplace that the vast majority of surgeons, at least in hip and knee replacement, are using robots or robotic technology or other technologies such as computer navigation surgery. I think that as we show that the robots improve our surgical techniques and hopefully able to show that they also improve our outcomes, they will become more and more commonplace, and we'll see them more and more in different operating rooms across the country and across the globe. I think that this may take some time, but it's hard to envision a world where the robots that we have in surgery disappear. I think that technology overall improves our outcomes, and I think that we'll see more and more of it as the years go by.
Great. And are there specific patients or candidates or cases that are a good fit for robotic assisted surgery, or is this something that you're using with all of your patients?
It's a great question. Each surgeon is different, and each surgeon has their kind of own perspective on who's the best candidate for robotic surgery. Many surgeons, at least in hip and knee replacement, use a robot for assistance in every knee or hip replacement, or at least the majority of them. And some surgeons choose to use them in only unique cases, more complicated cases, or more simple cases. I think that we're still trying to figure out and show in which cases that it may or may not be most important. And for me, I use it in the large majority of my knee replacement cases, and I use computer navigation in many of my other cases as well in my hip replacement cases. So, and I think that it's overall has improved my ability to treat my patients, I believe. But each surgeon is different, and I think that the clinical decision making at the end of the day falls to the surgeon.
Mm-hmm. Yeah, and I did see one question in the Q&A that I'll address now. I know we've seen, for some example, with the metaphor of the car, we've seen some Teslas like drive off, or some cars with robotic assistance go haywire. So the question was, do these robotic surgical devices have some sort of override? What does safety look like, I guess?
It's a great question. Yeah, I think that safety is the most important thing. And I'll even take it a step back. At the end of the day, the surgeon or myself or whoever it may be should be able to do the surgery without the robot. So, technical issues happen, whatever the robot or the computer navigation tool, whatever it may be. If it doesn't work, the surgeon has to be able to continue the surgery with the standard procedures, which is what we do, which is what we're trained on, and it's something that we can do. It's rarely happened, but it can happen, and things can go out. There could be a power outage, some sort of circuit. But to address the issue of safety, is the robot kind of going haywire, doing the wrong things? Generally, no. The surgeon controls the robot live. So the robot can't do right now the surgery without the surgeon actually participating in the process. The surgeon at the end of the day has to have a close eye on what they're doing. But again, the robot's helping execute the cuts, but not doing them themselves.
Right. It doesn't have that intelligence just yet, which actually perfectly segues to my next question. Sandra, can you discuss the Innovation Center for Artificial Intelligence in robotic joint replacement?
Sure. So that is another initiative that really comes from what Dr. Debbie describe as that increased, I would say, increased interest in using robotics, robots in all kinds of medical procedures, including the orthopedics. And we have seen that grow exponentially, not just in the United States, but across, in Europe and in other parts of the world. And obviously there are certain procedures that benefit from that approach better than others, but the developments are such that we will see more, and I think we are probably at the very early stage of that. I think we will see more and more developments and more reliance on that technology. But, and that's actually one of the segue why HSS made this initiative is instead of, as we see those technologies being more and more prominent, we don't want to be a passive observer of how they are developing, but rather actively understanding them and contributing with our clinical expertise to the development of those decisions, of those tools that make this, they could potentially make certain decisions, surgical decisions during the surgery. So, as also our robotic surgical volume grows, I looked at the data, and in 2021, we had about 20% of our procedures were robotic or computer navigation performed. And in this year, the data that I was looking just until the end of September showed already 23%. So it's kind of increasing. So it is really important that we understand how those technologies work and that we are actively participating in their development. And that's the goal of Innovation Institute. If we are to embrace those technologies, we need to co-develop them and infuse them with our best clinical practices to create the best tools that can be used in a clinical setting. So following that partnerships that we had with Zimmer Biomet on mymobility that was very successful, we continued exploring further areas of where we could potentially influence, and make further contribution in the orthopedic world. And we created in this summer the first in its kind innovation center for artificial intelligence and joint replacement, where we would infuse HSS clinical expertise, surgical expertise, with Zimmer Biomet's robotic technology and AI modeling to develop, test the hypothesis and develop the models that we can test on a real patient data, and generate potentially new clinical insights that can be infused in those robotic tools that Zimmer Biomet is going to use for their knee and hip systems. And we think that that is very important because, we have seen that this technology has proved certain advantages, and they obviously, there needs to be more cases to prove that validity. But in many cases, recovery times could be shorter. Surgery could be less invasive. It could be done with more precision. Dr. Debbie explained those benefits. So it is important to take advantage of those and continue further to generate data that now can be generated intraoperatively by using those tools, and align them and based on the data, generate new insights for the future improvements. And we do hope that the goal is to have a better outcomes in the end. So it's a long process. The agreement was signed this summer. It's a 3-year partnership, and we are very excited. We're at the beginning of putting the teams together to work on that. So it's great to see like surgeons, our expert surgeons, data science teams, and working together on this.
Yeah, I think it's so great to kind of see how, the way you put that, because, at the end of the day, we're always learning, right? We're always progressing. And, it's, the fact that we have this technology, whether it be the robotics or computer navigation, the operating room, doesn't mean that suddenly, we've solved all the problems. In fact, now we're suddenly seeing that we can do things in other ways that we haven't thought of before. And I think it's, again, having that data and able to synthesize it and then make decisions moving forward from a clinical standpoint is kind of where we're working as a partnership.
Fantastic, thank you. And we're thinking about creating solutions, and I know one of the largest innovations that we might have seen, and Dr. Debbie, you certainly chime in here, is implants. So let's talk about implants. Generally speaking, how have implants changed over the last few decades, and what can patients expect now if they're going through a joint replacement?
So it's a question that I address basically on every patient visit. I mean, many patients, ask me, how long will my knee replacement or hip replacement last? We don't have an exact answer, and I can't give one exactly, but we've made tremendous progress in our implant designs over the years. And now in most surgical procedures, we have a polyethylene, which is the plastic that goes into these implants, that is much better than prior versions that we had many years ago. And the wear rates of these plastic implants are much less than they were many years ago. So the hope is that our implants will last much longer than they did many years ago. But we're seeing patients also live to much longer lives, thankfully, and we're seeing these implants last longer and longer. So at the end of the day, I talk with patients about, should they be concerned about how long their implant will last? Well, yes, probably. But if they have severe pain and their quality of life is decreasing, it's, from my standpoint, it's much more important to kind of live the life you have now than worry about exactly how long these implants will last for your whole life. And from other implant design stuff that we have seen more recently that I think, is kind of a topic that is worth kind of mentioning is 3D printing. We see a lot of 3D printing now in our implants. And the reason for that is many of our implants are meant for your body to grow into them. So that means that your bone will grow into these implants and basically become one with your bone. It takes some time, and it's pretty incredible that bone can do this. But it leads to a very stable implant over the long term, is what we believe. And a lot of the 3D printing technology allows us to very precisely create pores in those implants at that surface to allow the bone to grow into that area of the implant. And we're seeing this becoming much more commonplace in many of the implant designs. And I think we're really just scratching the surface of where we go from here. And just as a specific example, hip replacements, many of them are implants that your body grows into. Knee replacement implants have historically been mostly implants that are cemented into position. And now with this 3D printing technology, we're beginning to kind of see, maybe implants that are for knee replacement that your body can also grow into, your bone can grow into. So that's all very exciting stuff, and something that we're actively researching.
That's so fascinating. When you're developing these 3D implants, is there a template that you're working off of, or do you design them for the individual patient?
That's a great question. So maybe one day we will just print them per patient for most cases. We're not there yet. We have implant designs and revision cases, really challenging cases or really challenging deformities. Patients that have had implants in for a long time that now need a new implant. And some of these implants can be customized to their anatomy based on high-level scans, such as CT scans. And we can kind of build an implant for that individual. But right now, we're not necessarily printing implants per patient for each regular case. I have looked at some of this technology, and maybe one day we will, which is exciting to think about, but we're not there yet for each and every patient.
Great. And I know that, Sandra, you're involved with customized 3D printing and the customized facility. So do you mind just talking about that briefly, the Lima 3D printing customized facility or center?
Sure. So I do agree with Dr. Debbie. We don't do that for every patient. We are not there yet. But we have created the first of its kind, again, provider-based 3D printing implant facility at HSS in collaboration with Italian company Lima Corporate. And so we are printing customized implants for a very limited for patients with very complex conditions and for revisions. I think we have capacity to up to 100 implants that we can print annually. We opened the facility in October of last year, so it's very new. And we do hope that that capacity will increase. So it's Lima, it's an Italian company that's printing and designing those implants in collaboration and help with our biomechanical engineers for our patients and for some other patients across the United States. And knowing, as opposed to, not having one size fits all implant for the patient, it's very important, as Dr. Debbie explained, that the implant fits well the anatomy, that integration is done properly for better outcome, and the surgery also is faster and easier. So we have spearheaded that initiative here at HSS, and we think it's very very exciting. I don't know what the future will be, but I do hope that in the same way as we, choose our shoes and things, that, there will be a more personalized, more ways to make those implants better fitted anatomy. And obviously, they require a better imaging to start with, the CT scans, MRIs, to be able to create a very precise design and implant.
It's from a clinician standpoint, I have to say, it really is a huge privilege to have this printing facility, here on campus. It's really unbelievable. And it's, you can visit it if you need to.
It's one of its kind.
It's really special. So
I was going to say, I
that's
want to
a
go
good
check it
highlight.
out. Looks awesome.
You should. It's really amazing.
Yeah. And we would be remiss to not discuss smart implants. And so, Sandra, I think you almost alluded to this earlier when you said that, our clinicians don't have access to movement and mobility after surgery for their patients. And so let's talk a little bit about smart implants. Dr. Debbie, what are they and how are they being used to measure recovery and monitor recovery?
So it's a great question. I think this is just the tip of the iceberg, the very beginning. We're talking about implants that have the ability to basically track the patient in some sort of way, whether it be motion or, their step or their gait in some sort of way. Some of these implants are being used today. But again, I think that it's still very limited. But we have the data, and again, it's one of those cases where we're looking at the data to allow us to basically see how it is improving our outcomes. And I think that with time, we'll see more and more of these implants, I think. But I think really it's one of those, just the tip of the iceberg, kind of seeing what kind of data it's giving us.
Mm-hmm.
Yeah, and real quickly, Sandra, I can bring up the Persona IQ, the Smart Knee, just so folks can get a sense of what it looks like. It looks pretty similar to a normal knee replacement, huh?
So, right, except that it has those sensors that and the chip and the battery that has a 10 lifespan that can collect data during that time. But this was that Persona IQ smart implant that we see on the images was the first implant ever to be, performed, the first knee replacement surgery with a smart implant to be performed. There were 2 surgeons from HSS who performed it last year. And the Persona IQ was developed by Zimmer Biomet company, and as I mentioned, there are sensors that are built into the TBL component of the implant. They have a chip and the battery life of 10 years, so it collects the data. So the important thing about them is that after the surgery, as I said, We, up until now, we didn't have a lot of ways to collect the data on movement data from the patients. It's now could be done through the wearables, through other sensors. But implants, implanted sensors have more accuracy and are collecting more data, speed, walking speed, gait, various range of motions. So it's very early, as Dr. Debbie said. It's less than 100 cases that we have performed. We continue to do them, and very cautiously to understand what's the meaningfulness of that data, and in order to expand. But that's another way how technology allows us to, gather more objective data and see if it could help us with clinical insights and to further advance the treatments and the outcomes.
Yeah, and at least with this smart knee, you know that your spouse or partner won't be wearing your device.
Right.
That shouldn't happen.
Hopefully not.
And that you're not turning it off, turning it on. It's a continuous collection of data.
You don't have to charge it.
Yeah, for 10 years.
Right.
That's pretty good. That's pretty good battery life. I know we're close to time here, but if you all don't mind, there are two really fantastic questions in the chat that I'd like to address. Have there been any studies comparing overall outcomes over time of robotic joint replacements as opposed to non-robotic joint replacements?
A great question. There have been, and we're continuing to do these now. And I think, again, as we see more and more robotics, we'll have more of those cases to compare. So I think, the data goes back and forth, and I think, some of the data shows that we're able to more accurately execute the surgery that we want to do. And I think what is kind of something we're still trying to see exactly is how are patient outcomes improving with robotic surgery versus non-robotic surgery. So I think we're still early in that phase. And as we kind of get more and more data, we'll have more of those studies to show. So I'm, part of these studies, and, we're doing these currently. And with time, I think we're going to see more and more of these studies come to fruition and show us more of what those results are.
Great. And just for clarification, could you clarify what the robot is actually doing? There seems to be a question about what the robot is doing in a hip replacement specifically.
The robot in a hip replacement, sure. So there's not many robots in the hip replacement. There's a few. The one main one allows one to very accurately preoperatively plan the surgery. So it's not doing anything. It's a software, and that's really an incredible aspect of the robot. And then the robot itself, it has an arm that allows you to prepare the pelvic bone for an acetabular socket that's made out of metal. And so the socket that's placed in the pelvis is generally a metal socket, but your pelvis has to be prepared for that socket with what's called a reamer that removes your native bone, an arthritic bone, and prepares it to accept a metal implant. And so the robot is able to basically ream that bone, but again, it's with the hands of the surgeon. So the surgeon's still the one reaming and preparing the bone, so to say, but the robot's helping guide it to the numbers that the surgeon planned.
Great. Thank you for the clarification. And finally, the last audience question is, which I was wondering as well, is what happens at the 10 years of the battery life, Sandra, with the smart knee?
I'm interested too, Sandra.
We don't know yet.
Wait, you're muted. Yeah.
Yes, I guess I haven't confirmed with Zimmer Biomet, but I believe that then the data collection stops because if the battery doesn't work, it can't collect the data. And hopefully, hopefully by that time we have collected enough meaningful data to that battery actually works like a peacemaker. It has the same, it's a similar battery. So Hopefully through that time, we have collected enough data to advise the patients through their recovery on the things what to do. And I guess we would need to make more technological advancements to make those batteries with a longer lifespan. And hopefully the patients continue to use that implant for much longer than the battery life.